In certain infants and young children, Synagis Vial is used to prevent serious lung infections, such as pneumonia, that are caused by a virus called respiratory syncytial virus, RSV. It works by preventing the growth of the virus. It's important to note that this medication is not used to treat RSV infection, but should be continued even if your child gets the RSV infection to prevent a more serious infection. The dosage and timing of administration should be determined by a healthcare professional. Before your child starts receiving palivizumab and before each injection, make sure to read the patient information leaflet if available from your healthcare professional. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is typically given into a muscle, usually the thigh, by a healthcare professional as directed by your child's doctor. It is usually given once a month during RSV season, which in the Northern Hemisphere starts in October and runs through April. The dosage is based on your child's weight. To get the most benefit from this medication, your child should receive it regularly. To help you remember, mark the days on a calendar when your child should receive the medication. If your child experiences fever, pain, redness, or swelling at the injection site, it is important to inform your doctor or pharmacist. This medication has been prescribed because the doctor has determined that the benefits outweigh the risks of potential side effects. While many people using this medication do not experience serious side effects, it is important to be aware of potential allergic reactions. Seek medical help immediately if you notice any symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, so it is crucial to contact your doctor or pharmacist if you notice any other effects. Before giving your child palivizumab, make sure to inform the doctor or pharmacist about any allergies your child may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your pharmacist to understand more. Also, be sure to let the doctor or pharmacist know about your child's medical history, especially if they have any bleeding or blood clotting problems. If your child is going to have surgery, particularly certain heart procedures, it's important to inform the doctor or dentist about this medication and all other products your child is using, including prescription drugs, non-prescription drugs, and herbal products. This medication is generally not used by adults and is unlikely to be used during pregnancy or while breastfeeding. It's important to be aware of potential interactions with other medications, as they can affect how Synagis Vial works and may increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Also, be sure to inform lab personnel and all your doctors that you are using this medication, as it may interfere with certain lab tests, potentially leading to false test results. If someone has taken too much Synagis Vial and is experiencing severe symptoms like fainting or difficulty breathing, it is crucial to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to keep up with all your regular medical appointments and laboratory visits to monitor your progress and make any necessary adjustments to your treatment plan. Make sure to give your child each dose of Synagis Vial as prescribed by the doctor. If your child happens to miss a dose, be sure to speak with the doctor or pharmacist immediately to get a new dosing schedule. This medication, Synagis Vial, is typically administered in a clinical setting and is not intended to be stored at home. It is used to prevent respiratory syncytial virus, RSV, in high-risk infants and young children. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific medical needs. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.